Hi everyone. So today let's get started up with discussing the cranial points. So first of all, I'll enumerate all the cranial points which are present in the skull, and then we'll proceed on to understanding about these cranial points. So in total there are 11 cranial points. First one is Terion, then second ASTERION, NASION, the fourth one is RHINION, fifth Ganatheon, sixth is GONION, seventh is PROSTHION, eighth is MENTON, ninth is PORION, 10th is BASION, and 11th is INION. So let's begin with studying about Terion. So this is Terion. Now as you can see, Terion is basically a H-shaped suture, and this is a suture between the frontal bone, the parietal bone, squamous part of the temporal bone, and the sphenoid bone. Okay. Observing it on a original skull, this point basically corresponds to Terion. See. This point. Here you can see H-shaped suture. Okay. So this point basically corresponds to Terion. Now beneath this point Terion, three very important structures lie. The first one is the anterior division of the middle meningeal vein. The second is the anterior division of the middle meningeal artery, and the third is the stem of the lateral sulcus. Now what happens is that in the roadside accidents, this anterior division of the middle meningeal artery, which lies beneath it, gets ruptured, leading to extradural hemorrhage. So this hemorrhage or this clot basically suppresses the motor area of the brain, resulting in the paralysis of the opposite side. So this point is clinically very important point. Next, second point is basically ASTERION. Now see, this point corresponds to ASTERION. Now ASTERION is a point, as you can clearly see, is a point of the meeting of the three sutures, the lambdoid suture, the parietomystoid, and the occipitomastoid suture, right? Isn't it? So now ASTERION is basically a point which corresponds to the region of the mastoid fontanelle in case of infants. What I mean to say is that this is the point where mastoid fontanelle is present in case of infants. Okay. Now next, point number 3 is basically NASION. Now see, NASION, this is the frontonasal suture, while this is the intranasal suture. Now the meeting of the frontonasal suture with the intranasal suture forms a point which is called as NASION. Okay. Now next, as you can see, intranasal suture present between the two nasal bones. These are the two nasal bones with intranasal suture between them, and this lowermost point of the intranasal suture is basically known as RHINION. Okay. Now next point which you have is basically the Ganatheon. The Ganatheon is the middle point of the base of the mandible. So it is also called as the mental point or the Ganatheon. Now see, this is mandible and this is the base of the mandible. Okay. So exactly in the midline you have a point which corresponds to Ganatheon or the mental point. Next, the point on the angle of mandible basically corresponds to GONION, right? Now next point which we have is basically PROSTHION. Just a second. Now see, this point which you can clearly see is basically PROSTHION. Now PROSTHION is also called as the alveolar point, and it is a point on the alveolar arch midway between the median maxillary incisors. Now see, just see, now this is the maxilla, and exactly over here midway between the two maxillary central incisors you have a point called as PROSTHION or the alveolar point. Next, point number 8 is basically the menton, and it is the lowest point on the mandible or the chin. Now see, this point The lowest point on the mandible or the chin corresponds to menton. So please just don't get confused with Ganatheon. Ganatheon was the point lying midway between the base of the mandible, while the lowest point of the mandible or the chin is basically menton. Point number 9 is basically PORION. Now PORION is the point located at the upper margin of the external auditory meatus. Now see, in an original skull, this is the external auditory meatus and this is its upper margin. This is the upper margin. This is basically the external auditory meatus. This is the upper margin, and exactly over here, somewhat midway on the anterior margin of the external auditory meatus, you have a point termed as PORION. Point number 10 is basically BASION. Now BASION is basically a midline point of the anterior margin of the foramen magnum. Now see, this large foramen on the Norma Verticalis is basically foramen magnum, and this is its anterior margin. Okay. On this anterior margin, a midway point is present, which is called as BASION. Next, the last cranial point is basically INION, as I have already mentioned. This is the external occipital protuberance, and the point of the maximum protuberance on this external occipital protuberance corresponds to point known as INION. Okay. So this was all about the cranial points, and if you liked my video, so press on the like button and also do subscribe to my channel Fundamental Studies, and do hit on the bell icon for latest updates and notifications. Thank you.